Good evening. Welcome to the Village Board April 1st legislative session. We are meeting again virtually. I'm going to just welcome everyone and give us a little overview of what to expect on our virtual legislative session. And then I'm going to invite Lindsay Farrell to give us a presentation. In a moment, we'll ask her to speak with us because she is the leader of our largest healthcare agency in Ossining, and obviously you're in the middle of a healthcare related crisis. And we're so grateful that she can be here with us today. We all have a lot of questions. We've solicited questions from the community as well. And I know that Lindsay's gonna do her best to give us some understanding of what exactly she's seeing on the front lines in healthcare. I wanna thank the members of the public who did submit questions and who have been thoughtfully asking what we can do to help and what's really happening out there. After Lindsay gives her presentation, any other members of the board who would like to ask questions that may not already have been communicated with Lindsay can. This is our first legislative session that we're doing virtually, and so we're experimenting with a slightly different setup than we did last week, and we'll do our absolute best to have everyone participate as they would if we were in person. So when there is an opportunity for the public to weigh in, whether that's with an organizational announcement or with any comments about the resolutions, our clerk, Martha, who you can see on her little part of the screen, will be setting up the timer, 2 minutes for organizational announcements, 4 minutes to comment on any and all of the resolutions. And it's going to be our first time experimenting with the public raising their hand. The folks who are on the screen are members of the village board or staff or our guests. Members of the public who are attending are not seen on the screen, so if you want to raise your hand, please go ahead, look on the bar at the bottom of your screen. You'll see something that says raise your hand, and then one of us will know that you'd like to raise your hand and comment when it is there's an opening for the public to comment. And also, please be mindful that in that same area on your screen, you can hit mute. And if you are not somebody who is part of the group that's speaking at any given time, please do mute it. It's surprising how much background noise there is in all of our homes. So with that, oh, one other thing, I think we have disabled the chat function on our, okay, then I won't worry too much about that. There's some crazy stuff happening with Zoom in the world, you know. Crisis brings out the very best in most of us, but the very worst in a few people. So with that, I would like to formally welcome Lindsay Farrell from the Open Door. Lindsay, thank you so much for joining us. I know that you are working so hard with your team every waking hour to help see us through this. And what are you seeing? How can you help us better understand what's going on and what we can do to help our community get through this?
Thanks so much for inviting me to participate. I think we're in week 3 of the coronavirus and its impact in Westchester after a very intense experience down in New Rochelle. The virus, has sort of made its way across the county. I'm really pleased to let you know that I think we were one of the first organizations in the county to do testing. And so we've been testing for more than 2 weeks. We might be on day 16, I believe. We don't test on Sundays because we're not open. And so we have been doing a lot of testing for people who have symptoms or for the Open Door staff who've been exposed to others who we think have the virus. So when you look at in the Journal News, they print an article and they show numbers of testing by locale. Ossining looks particularly high, but by and large, that's because of the Open Door. We had access to tests before anybody. We're doing a lot of testing, but the positivity rate in Ossining is actually consistent, maybe not quite as high as some of the other Open Door locations across the county. I was concerned initially. I thought, oh my gosh, is Ossining a hot spot? And so we actually trended the data. So we look at the total number of tests by Open Door location, and we compare that with the total number of positive tests. So right now, our positivity rate is 37%. In other locations, it's a little bit higher. In some locations, it's a little bit less. Ossining is fairly consistent with all of the villages where Open Door operates in Westchester County. It's up to the doctors to decide ultimately who's allowed to be tested. The real problem with this epidemic is we simply don't have enough supplies. We don't have enough personal protective equipment. And when you test somebody, we do it using a nasal swab that goes into a tube, a carrier, and then is sent off to a laboratory. But when we take that swab, my staff has to be in full PPE. So we have to wear masks and shields and gowns and gloves. And the problem is we simply don't have enough of it. It's not available. It's not available in the state. It's not available in the country. We can't get our hands on it quickly enough. And so we've really had to pull back on the amount of testing that we're able to do. Everybody would love to come in and be tested and to know their status, but we're only able to test people who have significant symptoms, right? And a significant symptom is you must have a fever or you must have a cough. You must have these sort of flu-like symptoms in order to be tested. And it's up to the doctor to decide if your symptoms warrant testing. So unfortunately, there are people who've come in and we're not able to test them because we simply don't have the resources to be able to do that. That being said, we've tested hundreds of people, and in Ossining, I think I saw in the paper today that Ossining was showing positives around 150, and I think of that 150, Open Door probably has about 130 of those. Another interesting thing for everyone to understand is that we've had to completely change our operations. You can't have a lot of very sick people roaming through your facilities from an infection control standpoint. And so we have staff standing at the front door with thermometers in full personal protective equipment. They're taking temperatures, they're asking about symptoms, and if somebody has a temperature and has symptoms, we literally direct them around to the side of the building where we have a tent. And the tent is where people are sitting until we're able to take their specimen, and the physician is actually speaking with them and then sending them on their way out of that tent. So we're trying not to have sick patients in our facility because obviously it puts everyone at risk. Now, it's my understanding that a lot of doctors' offices have closed and aren't able to even provide access to care because they just don't have the resources or the inclination to do it. So that has led many others to come to the Open Door. And of course, if you're local, we are very happy to see you, but we've had people coming, wanting to come from Brooklyn, if you can believe it. We'd have people calling on the phone, wanting to come up for a test from Brooklyn, which we're simply not able to offer them. So it's a very interesting time to be. I've never done anything like this, and I've been doing this for many, many years. We've never experienced a pandemic quite like COVID-19. That being said, it's really important to get your flu shot every year, and we can't wait until there's a vaccine. We think a vaccine will be coming. I watch Dr. Fauci almost every day, so we think that a vaccine is forthcoming probably in about 18 months. So we have to get from where we are now to the time when a vaccine is able to really prevent something like this from happening again. So I'd be happy to, Victoria, I think you had a whole bunch of questions, and I'd be happy to respond to your questions if you'd like.
Well, I think we forwarded them to you by email, so I'll just look through my emails and see what those were, because you did cover a lot of them right now.
What do we do when somebody has a positive test?
There you go. Yeah, so when somebody has a positive, thank you. Very nice. When somebody has a positive test and you give them that news, what other information do you share with them?
They need to stay home and they need to isolate themselves from others. Now, easier said than done. If you don't have your own bedroom, if you don't have your own personal space, ideally you have your own bedroom and you have your own bathroom and you do your laundry every single day. How feasible is that for everybody. Sometimes that's particularly difficult. We like to send people home with a mask. The mask really helps the person not, spread their germs to the other people that they might live with. But the most important thing that you can do is stay home. And if you don't have symptoms, you really, you can go about your business, but that's to be said. Right now, we're all pretty much at home and doing what we do at home and trying not to go anyplace else. And we think that this will continue. I don't have any insight for how long it will go on. It looks like the governor, it looks like this is going to go on through April, and it'll be very interesting to see if it goes on past April.
So the number that I'm hearing from the governor and others is, maybe 3 weeks, 2 to 4 weeks when we think this will peak.
Yeah.
And then I think the governor's indicated he's sort of trying to figure out what happens then. Could you speak to us a little bit about, is from a medical perspective? I know the test that you're doing right now, or my understanding is, and so correct me please, but the test that you're doing right now recognize if someone is currently positive, not that they may have been sick a couple of weeks ago and they've recovered. And if that's the case, then if they come in and get tested now, they won't test positive, and we won't know that they had it.
We would never do a second test because we simply don't have enough tests. So
Right.
basically you get one test at the beginning and that's it. And the instructions are, you should self-quarantine for 7 days. And if you don't have a fever, and you feel okay, you can go about your business after 7 days. If you've had a fever, they say that you need to self-quarantine for another 72 hours after your fever ends.
And you wouldn't, if somebody came to you for a test for whatever reason, they were symptomatic, if they had it, the tests that are being done right now wouldn't indicate that they've developed the immunity. And
no,
then also,
I think that we don't have that. I think Abbott just developed that, but I don't think it's available yet.
Okay. And do we know if you will be immune, if you've had it, if you will have developed an immunity to it? Do we know enough about the virus yet to be sure about that?
We really don't. We don't.
Then I have a couple of other questions here from a community member having to do with what is the best way for all of us in leadership positions to educate Ossining residents on best practices? What have you found to be the most effective way to reach people, and what's really resonating with people?
So we've made a bunch of videos, and they're on our website and our Facebook page. And so we've been pushing that out to all of Open Doors patients. We do it via text, and there's a link, and there's videos in English and in Spanish. I mean, that helps us because we have just incredible demand. I mean, we're getting like 1,500 telephone calls a day. So, we're hoping that if people are educated, that places a reduced burden on our telephone system. But I think there's so much good information out there, whether it's the Westchester County Department of Health website, the CDC, there's lots of information out there. And it's just a question of, making people aware of what the appropriate practice and protocols are.
And then one of the other concerns that we have is food insecurity, and people also all of us need to be able to get food, whether it's at a distribution center or at the grocery store. And I know we generally tell people stay 6 feet apart, but are there recommendations that you have? How do you advise people on what's the safest behavior, the safest practices that they can implement when they do go to the grocery store, when they do to go to a food distribution line?
You have to eat. So eating is important, and just try and spread out in the store. I mean, many of the stores are only allowing so many people in at a time. So I think the grocery stores are doing a good job. I know Stop and Shop, if you're a senior, you can go in early in the morning, and I think that's appropriate. But obviously we all have to be respectful of one another at this very challenging time.
What are the biggest questions you're hearing from your patients? What are their biggest concerns? What are they most unsure about?
People, it's really, wanting to work and needing to work, and how long is this going to go on? And we just don't know. Again, we're just trying to do a lot of education, particularly if somebody is sick and has tested positive. We send our patients home with thermometers and blood pressure cuffs, and lots of communication, because obviously if you watch the news, some people don't do very well. Most people do fine, but some people don't do well. And so we have lots of communication with folks who've tested positive. Most people do well. We do have 4 patients in the hospital right now, so that's scary. It's scary.
Yeah. Now, we talked about food a little bit and the virus a little bit. I've heard, and I'd like you to confirm for me, that cooking actually does kill the virus, though freezing does not kill the virus. Can you speak
honestly,
to that? Not your purview.
No, and I they just don't know whether this thing is going to end as the weather gets warmer. So, Columbia University has lots of resources. I've been really interested in virology, and there's lots of podcasts that you can listen to from just world-renowned experts. But no, at this point, they just don't know.
Okay. You mentioned that when you have someone who is a patient, you send them home with a mask. I know I'm hearing so many mixed things about masks and gloves, and I know there's a shortage of PPE for people who are working on the front lines in the medical field. What do you recommend for best practices? I kind of see people walking around with gloves and just touching everything with their gloves on, and you probably aren't washing your gloved hands.
Right.
So are there, do you have advice for people when they should be using masks and gloves? When is it really beneficial, or is it sometimes not a good use of those limited resources?
Apparently the CDC is perhaps changing those recommendations, and I was just watching the news earlier, and it looks like they may be recommending that people walk around with a mask. Now, do you have the mask on properly? If the mask is up on your head, that's not necessarily the appropriate wearing of the mask. And can you even buy a mask? If you go to the store, you can't even buy them. So we have a whole lot of very nice people making masks for us, and so we're sending the homemade masks home with our patients, and then that preserves the supply for the healthcare workers at the open door.
Okay, so I know there are some people, this is my last question, and then I'm going to open it up to trustees who might also have questions. There are some people who still have to go to work each day, and they're reporting to work each day, and I know that there are more protocols that have come to us that are constantly evolving. Can you tell us what are the recommended protocols for people who do have to go to work, whether it's at the open door or wherever the essential workers are going?
So spread out. It depends on the type of office space that you have. If you're all on top of one another. In our call center, we spread everybody out, and we try to move lots of folks into vacant offices because others are able to work from home. So spread out is the most important thing. Wash your hands regularly. So lots of Purell and wipes should be available. That's it. And if you can work from home, you should work from home.
Okay. So thank you very much, Lindsay. And I want to open it up to any trustees or staff who have questions for Lindsay while she's here. If there's anything you just want to make sure that the public gets to hear from a healthcare expert. I do have to run away for a second. So we just lost our deputy mayor. Oh, there she is. Hi, Rika. Rika.
And I was looking at something. I'm here.
So you were listening the whole time then.
Oh, no.
I'm going to step away for one moment. I'm going to step away from one moment. If you could just share the meeting while I'm away and make sure everybody who wants to ask Lindsay questions has a chance to. I'll be back as soon as I can.
No, I'm hearing the whole thing. Hey, guys. Anybody have questions?
Hey, Rika.
Should we start going around?
I'll jump in. Hey, Rika. Hi, Lindsay. Omar Lopez here. Thanks for coming to speak to us today.
Welcome.
Yeah. So my first question is, you said that folks with a fever or other symptoms are the ones that you are testing. I'm curious about that. Is it a fever of a certain temperature for a certain amount of time? Can you tell me a little bit more about that?
It's over, I think it's 100.4. And again, this is all recommended by New York State Department of Health. So no, not for any period of time. If we take the temperature and it's over 100.4 and you have other symptoms like the cough, flu-like aches and pains, then again, it's up to the doctor. If the doctor determines that you're a candidate for testing, then you will likely be tested.
Is there a cost associated with testing?
No.
If someone tests positive and they're hospitalized, what does the cost associated with that look like?
And this is, I was just watching, the president and Mike Pence's press conference, and like they couldn't really answer that question. So obviously, some people have health insurance, and that's a good thing. If you don't have health insurance, when you get to the hospital, they will help you apply for Medicaid. And typically, if you need to be hospitalized, the hospital will get you Medicaid, regardless of your status.
Thank you. You also mentioned servicing people from Ossining specifically. How do you know that people are from Ossining?
Oh, yes, where they live. We have their addresses.
You do? Okay.
Yeah, we have to register them. Yeah, we have to register them. We have to set up a record. Yep.
And are you seeing trends in the ages of the people who are coming in symptomatic?
It's fairly young. We have very few patients over 65. I mean, that's not a big population that we serve. So our positives skew below 65. And the bulk are between 20 and I think 55.
Mm-hmm. How can people who want to be supportive be helpful?
Stay home. Don't go out.
But would it be helpful if they people are looking for some way to be helpful? So you mentioned people making masks. Is that something that would be helpful? Sending you money? What would be helpful?
Yes, mask making. Again, I think there's something up on our Facebook page, and you can Google in their instructions. There's lots of information about how to make a mask. It's not a difficult thing to sew, and we're using over 100 a day. So there's a lot of need there. We also have lots of local restaurants who've been donating meals for our staff. I mean, I can't tell you, our staff, they're like heroes. They're working so hard. It's really very unprecedented, very unprecedented. And as I said, we don't have as much PPE as we would like, so they really can't change their gown after every patient. The masks, we do have shields. We have supplies now that will last us through the end of next week, but then, I'm just praying that our shipments come in for the following week. Normally, we wouldn't be running with these low inventories, but it's a fact of life in this pandemic.
Thank you. Those are my questions.
Thank you.
Anybody else?
Yes, if I may. Hey, Winston, how are you? Thank you for being with us tonight. It's very helpful, a lot of the information that you have provided us and all the work that you guys do on Open Door for our community. So I want to thank you.
Thank you.
For the stuff that you guys been doing. So I just had one quick question. So you mentioned that someone comes in, someone tests positive, and then they get to go home, isolated. What do they take?
Nothing. There's no treatment.
There's nothing.
Really, Tylenol. Yeah.
Yes, that's what I was gonna say. So for the temperature, but I heard about liquids. You have to drink a lot. So how does that work for the next 14 days?
Yeah. I mean, again, it's just like having a cold or having a flu. But unfortunately, we don't have medications. They're testing some medications right now, and perhaps it will take quite a bit of time before those tests are complete. So right now, doctors are really just recommending take Tylenol. There was some concern about taking ibuprofen. Again, no research is available to substantiate that. But Tylenol seems to be the only remedy, and that just alleviates some of the symptoms. So, I'm a big one for hot tea and chicken soup.
Thank you. That's all I have. Thank you.
You're welcome.
I see, Victoria, you're back. That's not just the background.
It is truly me. It is truly me, not just a lovely summer night scene in downtown Ossining.
Yeah, that light's been green behind you for a while. I just have one or two simple questions for Lindsay. You mentioned the number that's coming out of the Open Door was 150, I believe.
It's 150. I read 150 in the Journal News, but we're at 132, I think. So
Okay,
there's
so,
people that from
Out of-
Austin tested, maybe at Phelps.
right, out of the 132, what is the number of Ossining residents? In other words, how many Ossining residents? And you mentioned that someone from Brooklyn called you. What is your circumference of area that, if someone asked, could they go there?
Pretty local. I mean, the vast majority of our patients are 10562. So I know we do have some patients from Croton, for example, but I think like 85% of the folks that use the Open Door have a zip code of 10562.
And-
Okay,
and
thank you. That's all I had.
were there any other questions from electeds or staff for Lindsay while she's still with us before we let her go on and keep
If I
saying
may,
no?
I'm raising my hand.
Rika.
Lindsay, I don't get to see you at Srika, Levin. I don't get to see you very often except at events. Next time under better circumstances, I hope. I do want to say that I'm learning a lot from this pandemic. I had another friend's parent pass away today. There was one yesterday morning, and I've had 3 deaths in 3 days. One of them had tested positive because it occurred to me that the senior homes, the residences are also frontline heroes. I totally agree with you. Your people are definitely the doctors, the nurses, the aides. I want to thank you really for your service and everything that you do. And the aides and so on that work in nursing homes equally are facing something they've never had to face before. I am really proud of living in a community that has your facility. I know that you're not just in Austin. We drove by there earlier today and sort of saw you in action from the outside only. So I do want to thank you. What is it exactly? Omar asked the question what people can do, but is there something that this group of people specifically you would ask to do something from any sort of point of view aside from increased communications? Omar had asked a similar question, but is there something that the elected officials, are you getting enough support from elected officials around the state that we might be able to push on, etc.?
Yeah, Richard Wishney has been amazing. When I put out the plea for additional PPE, he was the one that really, just marshaled the resources. And, we go to the county's supply and, the hospitals take priority over us. And
Right.
So they might give us a box of gloves. And we just weren't able to get what we needed. So Richard just, put the call out, and we've had people contacting us all week, and we've had some great, sources as a result of, people just saying, I know somebody who can get N95 masks, for example. So our supplies are looking good. So if you have resources, now we will vet those resources, and you can't pay $5 a mask. It's too expensive.
Okay.
Right? I mean, N95 should be costing less than $1. And there's a lot of scams out there, but really the best thing you could do is, share the educational material on your Facebook page. For example, Dr. Wu in English and in Spanish, and he goes through a whole bunch of questions that people have been asking us. So share it on the Facebook page. It's a great video that we try and make several a week, as things change and things emerge. And, it's just our way of getting the word out to the community.
Okay. Well, thank you. I do appreciate and
Welcome.
tell all of your staff. It's just I'm hearing like amazing stories. They really are the heroes.
They're amazing. I know. They just rose to the challenge. I'm so proud.
Unbelievable. Yeah.
Really.
Thank you.
Thank you.
I want to apologize for not muting myself. When my child came in the room, I don't know exactly what was heard on your end of the room. Nothing terribly embarrassing, just nothing to do with this meeting. Sorry about that. And Lindsay, thank you so much for being with us. If anybody physically raises their hand, if you have any more questions or comments for Lindsay, or just chime in if you wanted to have any last words with her before we let her go on and we begin our meeting in the formal agenda. Okay.
Thank you.
Yes, Martha.
Thank you, Lindsay.
Raising your
Hello,
hand.
hi.
Hi, Martha.
Hi, Hello, hi, good afternoon. I'm the deputy clerk, and I just have one quick question because I've been seeing a lot of things on Facebook that are misinformation and information. There's people that are like, don't go out outside anyway, like, don't even go for a walk, don't go for a run. And there's people like, no, take a break because, being locked up in the house, you're cooped up, you want to go out, you want to stretch your legs. What would be your advice if you just want to go for a walk or for a quick jog? Like, how's the best thing?
Absolutely. I do it every day, right, Kevin? Yeah, you got to get outdoors. You got to breathe the fresh air. You need to move and exercise. Absolutely. It's when you see groups of people, not appropriate. And so, this is not the weekend to have the soccer game, right?
Yeah, definitely, for sure, yeah.
Right. But, it's so important to be healthy. In fact, I think the research will show that the healthier you are, the better you're going to respond to, influenza, right? Or a disease like the coronavirus. Right, it's all about lung capacity. So I think exercise is really, really important.
Okay, thank you.
You're welcome.
All right. Lindsay, thank you so much for being with us. And thank you to all of your staff for the incredible work that you're doing on behalf of our community and the whole region. It really does make a difference. And I'm glad to have another resource to be sharing of links. I'll take a look at the Open Door Open Door Facebook page and start pushing out more of that social media on any platform that I can. Thanks so much.
Thanks, Victoria. It's wonderful to live in Usning. We're so lucky. We really are. Thank you.
Thank you. All right. So, I think it's time for Mayor and Trustees announcement. Is that correct? All right. So I will turn it over to any trustee who would like to speak. Omar Lopez, I know you had something you want to say. Today is a very special day that I know you and I are very focused on making sure everybody knows. So I'll hand it to you.
That's right. It is Census Day, which I'm going to touch on in just a moment. But first, I want to give you a quick update on what happened last night. Trustee Quesada and I participated in the first comprehensive plan meeting with BFJ Planning. And please, Trustee Quesada, jump in with any color commentary here. But we got together and it was great to see everyone again. We haven't seen each other in a while. And in that meeting, we talked about the project schedule and how COVID-19 is impacting that schedule, especially when it comes to the public engagement aspect of the comprehensive plan. We talked about what the comprehensive plan was all about, the relationship between it and zoning and the New York State Environmental Quality Review Act, which is a really important part of the comprehensive plan, because when we look at what changes we want to make to our village, they're going to potentially have impacts on the environment, and we want to be conscious of what those impacts are. So we spent a long time talking about that and what engagement is going to look like online as the first step, since we aren't able to get together in person, especially to communities that are historically underrepresented in our community and throughout the country. So that was that. Trustee Quesada, anything that you would like to add to that piece?
No, really. I mean, you said it. Everything. And I mean, we are scheduled for next month to meet again. I think there was an internal meeting today with some of our staff members as well. There's a lot of coordination that they're going to be doing for us to take a look into. And at some point of time, we're going to start working on the subcommittees where we're going to be reaching out to a bunch of other group of people actually to help us, guide us on this process, and they engage the rest of our community as well. So we're going to be looking into a previous list of people who wanted to be part of this comp plan remapping, and so stay on the lookout. We're going to be reaching out to some few people, and maybe other people want to be involved as well. So hopefully we'll have a better understanding of that next month. And then we can go from there, and then we can start making more public announcements. I mean, I'm very excited on this. I mean, obviously it's a little bit different than what we all imagined to be, but it's going to work. I think we're going to make it work, you know? So no, thank you. That was a very good briefing of what our meeting was last night.
Absolutely. And second on my list is the census. So today is Census Day. This is Census Week. And you have gotten, likely at this point, 3 mailings if you haven't already completed your census. 2 letters and a postcard. As someone who has completed his census, it took somewhere between 8 and 10 minutes. It was really easy to do, available in many languages. And there are 3 main reasons why you should fill out the census. Number 1 is representation, number 2 is funding, and number 3 is local change. So representation is very important because the census is what is used to determine how many seats of Congress we get. And having that local representation is really important in getting our voice heard on a federal level. It also determines funding at a county and state level. And so that is where we get money for food for kids in school, for health clinics, for roads, and all sorts of things, and for local changes. So if you want to see more businesses in Ossining and you want businesses to hire more folks, they look at the census to determine how many people live in our village and whether it makes sense economically to open a business here, and many other changes. And so the census and being counted, incredibly important. I'm going to now attempt to give the same information in Spanish, and so bear with me for the non-Spanish speakers, and for the Spanish speakers, have much grace with me as I do this. So, el censo de 2020 está pasando ahora mismo y hoy es el día del censo. El censo es demasiado increíble por 3 razones. Número 1, representación. El censo determina la Cámara de Representantes que tenemos, y para que sepas, del 2000 a 2010, 8 estados ganaron escaños en la Cámara de Representantes y 10 estados tuvieron menos escaños en la Cámara de Representantes. Número 2 es fondos. Es demasiado importante porque, por ejemplo, el cuento determina almuerzos escolares, clínicas de salud, carreteras y muchas cosas. Y número 3 es cambio local. Si quiere ver un negocio en nuestra comunidad, fábricas, oficinas, restaurantes, tiendas, eso está determinado por cuánta gente vive aquí, cuánta gente puede comprar esas cosas o pueden trabajar en los negocios, y esos números vienen del censo. Entonces, por favor, coge 10 minutos, es bien sencillo de hacer, y por favor, hazlo no solamente para ti, pero para su comunidad. Muchas gracias. How was that, Manny, Martha, Victoria? What do you think, huh? How was that? Thumbs up?
Hey,
all right. Muchas
Omar?
gracias.
Omar, did you mention that there is, if you tab down, that you could do this? I think you could do it anonymously if you wanted to. Is that correct? There's a way to do it so that your name is not tracked, I thought. I didn't do it that way, but I was told that there is. Do you know anything about that?
I don't know anything about that. I will look into that. Mayor, do you know anything about that?
No.
Okay, I will
Okay.
look into that. Thank you.
Well,
Rita.
that might be
There-
something.
there-
I may
well,
have misinformation.
Well, there is a lot of information about the confidentiality and the
Okay.
reasons why this is kept confidential, and how this is, as a part of the Constitution, it has so many protections built into it, and the information becomes part of the census tract as opposed to identifiable as an individual household or person. So that might be part of what was being communicated to you, is the anonymity.
Okay.
And there are a lot of protections built in, and the page on the village website, if you go on the homepage and it says Ossining Counts and you click on there, one of the some of the FAQs there help explain why there is so much protection of confidentiality in
Right.
this.
So, Omar, did you speak to that in Spanish about confidentiality, that it doesn't get tracked? Right back to you. For those
No,
that
I
might be
asked
concerned about that.
the
Okay.
confidentiality, yeah. But
All right.
that's a good piece to add. That's a good piece to add. I will do that. I'm going to record a piece for Facebook specifically. So
Great.
I'll do that as well.
The PSA in Spanish for us, right? Thank you.
Yes.
Great.
Excellent. Okay. Thank you, Trustee Lopez. Other trustees with any comments this evening? Any updates for anything that's going on in your world?
I just have one little thing. I got in on the Ossining Arts Council meeting virtually on Monday, and it appears that they are in the process of planning to do an event in the fall sometime. So basically, they asked me what was their way of going about it, because they have somebody that is going to take the lead on this, and he was either going to charge a nominal fee or there was going to be no fee at all. They wanted to know what my take was on it, and I said, get yourself set up, come in front of us with all your ducks in a row at a work session, and it'll be discussed. So they asked me when, if they were thinking of September. I told them you should probably get yourself on the agenda sometime in July. So, and that was basically it. That was the biggest take out of that. It was interesting, but that was my biggest take out of that meeting. You know, they're planning something. Hopefully they can pull it off, and we're out of our houses by then. And I guess we'll be seeing them sometime in July. And that's all I have.
Thanks, Bob. In preparation for them coming to us in July, well, you'll be attending the meeting, so you'll have an idea of how it's evolving. But we should maybe prepare for their presentation by connecting them with whatever staff members might be able to make sure that when they come to us, we have all the information we need to be able to make a decision on how best to support them.
Yeah, I conveyed that to them. I told them, you know, as we're getting closer, I'll be at the meetings, if you need me to give you some direction or connect you with somebody, that just to reach out to me and I'll make it happen.
Great. Thank you very much. Trustee Quesada?
Yes, I just had a quick announcement. I wanted to make reference to the food distribution that the village is being part of it. I want to thank Jamie, Maddie, Karen, and everybody else that is part of this. It's very helpful for our community for all these events that have been taking place pretty much almost every week, I believe, in different settings. So I just want a quick reminder that this Friday, July 3rd, I will be at Market Square between 12 and 2 o'clock. So anybody that is in need of food, they definitely are welcome to go there, and they'll be provided with some food, a bag of food, I believe. Is that correct, Jamie? Yes. Okay. Thank you.
I think you said July 3rd.
I'm sorry.
You're
July
waiting
4th?
for the great weather
April,
that we have in July.
Sorry. Thanks, Rika. That's why you all laughing. I appreciate that.
Well, I'm hoping for the weather of July 3rd on April 3rd.
Hopefully by then we don't have to go through any of these troubles.
Oh, yeah.
April 3rd. Thank you so much, Rika. I appreciate it for correcting. So no, that's all I have. I mean, and all these events are actually, if you guys want to get information on this, is actually Jamie posts in our village website. Is also part of Facebook. And is being shared through different pages through our Facebook. So anybody, I'm not sure what is the percentage maybe of the people that have been that have been coming into these food distributions. Do you know, Jamie, or
I know that we get 900 meals that go 300 to each of the sites, but I think Maddie can talk more to she's more on the ground floor with that right now.
Yeah, so right now the USDA is requiring that we do take a little bit of intake information from folks who get the bags. It's not asking for names, addresses, anything like that. It's just basically saying who's in your household, how many children, how many adults, and how many seniors. So we're having our volunteers try to capture that information when someone comes up for a bag, just ask them quickly. We're doing our best. It's a little tough, and we haven't seen those numbers come back into us yet. So as soon as we do, we'll be sure to share that back with the board.
Okay, Dan. No, thank you for all the hard work that you guys are doing for our community. So thank you very much for that.
All right.
Are you done, Manny? I'm sorry.
Yes.
Yeah, I'm not going to repeat what's been said, except that I do want to thank all the staff in the village and in the town that have been holding down the fort. These are really sort of tough times for everybody. And to continue doing everybody's job the way they have is really a Herculean feat. It's really tremendous to watch. I do want to say, without naming all the agencies, for people to just contact me, the synagogues, the churches, all have a lot of social action groups. There are just so many to name. I'm not going to. There are all sorts of different groups that are set up because we're talked about food, which is essential. We talked about health, but isolation is what makes this pandemic so emotionally difficult for people. The economic aspect of how many people in this community Every household has been hit with loss of income at some way or another. Some folks who have dual career incomes, both people have lost their jobs. Temporarily, permanently, it's disheartening. I don't know what we can do about that, but helping people through isolation, is something. There are a lot of groups. So people can reach me at levin@villageofossining.org. I've got a very long list, depending on what you need and what language you need, and if you need people to speak to you or people to help you out. There's so many groups. Just give me, email me the information or call me on my line at 914-420-7941, and or text me on that line, and I'm happy to help whoever needs a contact to help with the isolation that we're all going through. Thank you.
All right. Thanks, everyone. We do have still a number of items to get to today, so I'll make my comments brief. This is certainly an interesting time that we're all living through, and a crisis brings out often the very best in people, and we have certainly seen that. Our instinct is to gather in groups, and what we need to do is to isolate ourselves, and that can be very difficult. And so forums like this are one way that we're able to still be able to get things done. That I appreciate Trustee Levin's invitation for folks to reach out if they do need help, whether it's just having a conversation or having someone to be able to go out and get things for them. That is absolutely what we need to be doing for each other. And it's so great to see so many people in the community offering to volunteer and organizing these kinds of efforts that are so essential for all of us to be able to flatten the curve. And as we know, it's going to be a few more weeks at the very least. I did want to just call to folks' attention. We know that the news of what is allowed and what isn't allowed and how things are gonna unfold is changing every single day, sometimes multiple times a day. Hopefully folks are finding accurate information and timely information. What the Village has done is create a page on our website that is all about COVID-19. So if you go right onto the Village website, it's right front and center. You can click the link where we have a lot of, we're regularly updating it. Thank you, Jamie Hoffman, for updating it regularly with links and with important top-line information that folks need to know. And we are also emailing folks quite regularly with one resource or another. So if you've not already subscribed to Village emails, I would encourage you to please go to the Village website, subscribe to emails. On Mondays, I send out an email that tells people what we're talking about right now and what we're going to talk about next week. And we also have the web blast on Thursday, but there's other information, particularly right now, that it is sometimes going out in between that as well. We are seeing new opportunities coming from the federal and state government, as well as the new mandates. Right now, there's a little bit of a shift of the conversation to talk about the financial implications that were mentioned earlier. And I know that a lot of local businesses are navigating the CARES Act that was recently put into place. So it's great to see so many community leaders in all areas reaching out to each other and trying to help each other get through this. And that is how we are going to survive as a community. On the elections front, there has been some consolidation of elections. The presidential primary that was originally scheduled for April 28th will now take place in June, when we have the primaries for the congressional and local races. And we just learned this week that the school board election, member elections, and budget elections have both been postponed to some date after June 1st, certainly not before June 1st. So that's the kind of information that is coming every day, new updates from the state, federal, county government, and the Village does our best to put that information out. So I encourage you to subscribe to emails from the Village, to periodically check the Village website if you are looking for a connection to information. And if you're on Facebook, to please follow the Village Facebook page, my mayor's Facebook page, and I know a number of other public officials that are doing our best to get information out there that is accurate and helpful. All right. So with that, we have an agenda here, and I will first pass it over to Manager DeTore. Do you want to give us an update on what is going on the day-to-day front of Village government? It's like never before, so please.
Thank you, Mayor. Good evening, Board of Trustees, Chief Sylvester. You know, as Lindsay said, we're going into our third week of the new normal COVID-19. And as we continue to deal with this crisis, the village is striving to do everything that we can to keep our community safe and as healthy as possible. We are thankfully able to continue all of our essential services. We're regular sanitation schedule, the things that we need to do to keep the village running, particularly at this time, and that's largely due to the dedication of our staff, who I cannot express enough gratitude to. Shortly, you'll be hearing from our Director of Personnel, Steve Sage, and he'll be talking about revisions that we need to adopt to our sick time policy to make sure that we are providing and protecting our employees and making sure that they have access to benefits afforded by the village as well as those by the federal government. So we are happy to be able to continue to ensure that we're protecting our employees to the degree possible, again, with some assistance from the federal government that you'll hear about more from Steve. He is working tirelessly on this. He's been working tirelessly on this. It's really been, he's been invaluable. So many things that affect our personnel policies, again, happen almost on a daily basis, and he's been able to keep up on all of them. So we really want to express gratitude to Steve especially. What's truly remarkable at this time is the number of heroes that we have amongst us here in the village. I would like to recognize all of our workers, our essential workers, our sanitation workers, our DPW workers, our code enforcement officers, our water department, our finance department, our clerk's office, our police department, our volunteer firefighters, our EMTs. There is no doubt that they are essential, but they have proven over and over and over again over the past few weeks just how vital they are to our community. And I would be remiss not to mention the diligent work of our Corporation Counsel, Stuart Kahan, who I'm about to embarrass. Stuart is working 24/7, making sure that we are in compliance with every new piece of legislation that comes down from the state or the federal government, literally minute by minute by minute. So without him, we would not be able to be doing as well as we can, because we know that we're in compliance. We know that we're doing the best we can under these very difficult circumstances. So thank you, Corporation Counsel Kahan. We all acknowledge your hard work. So while a lot of our capital projects have been put on hold during this time, we are moving forward on several important initiatives. And last week you heard about our events policy and an update on our youth bureau, our progress with the youth bureau. And as Trustee Lopez and Trustee Casada mentioned, that last night we had our first comprehensive planning meeting with our new planner, Jaime Martinez, and BFJ planners, planning consultants. It will be challenging to do this under these circumstances, but we also have a captive audience and probably more online engagement than we would ever have during any other time. So we will be using this time wisely to connect with as many stakeholders and subcommittee groups and the population at large. This is going to be a year-long process at least, so we will have time to make sure that we really do our very best to engage the entire community in this effort. I'd also like to thank Maddie Zahach and Jamie Hoffman for the work that they're doing. Because of them, we have had a very successful food distribution program that's continuing. In fact, tomorrow we'll be having another stakeholder meeting with everybody, the many people involved in Ossining who are involved in food distribution. We're actually going to try to coordinate it so that people will know that 7 days a week they have a meal, at least one meal, if not more, that they can get from one or or more organizations. And we're going to try to work with these organizations to coordinate and support them as best we can. And also, thanks to Jamie's prowess in social media, we're pushing through, we're pushing forward so much of the census information and trying to keep current with so many other things that are going on. So again, I want to thank the staff for working tirelessly during this time. I want to thank the board for their support, and it's a humbling time for me to be surrounded by so many heroes every day. Thank you.
Thanks, Karen, really appreciate it. I don't know if Victoria just left or not. I see her picture up there. I have a question for you. You may have said it. I keep flipping into emails and on my phone, so it looks like I'm not here, but I'm hearing everything. So I very much appreciate everything you said. I know that you've left yourself out of it, but no one should believe that you are not in the middle of all this as you are. And as a steward with so many executive orders coming down and interpretations and the daily life of everything that's going on. So I can't thank you on behalf of the whole board, but I'm sure that in some ways I can and should. So we thank you. I also, Karen, wanted to ask, to receive the food, are there parameters or qualifications, or do people just come down?
No, the food distribution that's happening virtually everywhere from every entity is for anyone who needs it.
Okay.
There's no requirements. Again, with the Feeding Westchester, there's some questions we have to ask because it's a federally sponsored program.
Right.
That's just to quantify how many, the number of types of people using it, but no personal information. If you need it, it's there.
By
Thank
types,
you.
you mean ages, children, seniors.
Yes, that's right. I'm sorry.
I just wanted to clarify. Yeah.
Yeah, the family makeup, let's say.
Got it. Thank you so much.
Thank you.
Thank you very much for giving that update to the public, and we are very, very fortunate to have you at the helm of the village management right now. We're really grateful for your leadership and for everyone that you acknowledged, the faces on the screen right now and all of the faces that we don't see every day that are coming to work under very stressful circumstances and supporting each other and supporting our community through it. So thank you so much. And Stuart, I believe you were one of the heroes that we were just hearing about. Do you have any updates for us, sir?
Just a personal note, when we talk about heroes, many of you may know my son is a paramedic, and so he goes out 5 or 6 days a week, doing a lot of transports, doing a lot of work. That's my hero, to be perfectly honest, and those folks. But Karen, thank you for the kind words. It has been busy. We have been living through some rather interesting times. We are in New York so far up to 13 executive orders, and I constantly refresh my computer to see if the governor has come up with a new one. He tends to do it in the middle of the night, and we get it the next morning. We did just get something yesterday which resulted in some communication to you folks with regard to landscaping. Previously, as of even last week, it had been understood that landscaping was considered to be an essential business. But yesterday, the Department of Agriculture and Markets announced that it is not an essential business. That would include tree pruning and anything along that line. The only horticultural business that is in fact allowed are nurseries in which products that grow food are actually sold. So that's it. Other than that, but as a number of the folks have mentioned, the rules literally change every day. The original definition of some, as you know, of an essential business did not, basically said all construction was essential. Last week, I believe last Friday, the Empire State Development came out with new regulations, which essentially said that unless it's for very particular purposes, construction is no longer considered an essential business. We are getting calls. I know the building department gets calls, and we get some inquiries up in the manager's area asking, what is it, if is a business essential or not? I really do not want to be in the position of telling someone it is or is not essential. I think the best thing for them to do is they can go to the Empire State Development website. They can actually make an inquiry and find out. Some are fairly easy to indicate that they are or not, but on some of the more difficult ones, all we're looking for is some confirmation from the state that that particular business can go ahead. I should point out that I'm sure the state is getting thousands of those inquiries. So if you do not hear right away, don't be surprised. But we do try to keep up to date on all the various executive orders that come out. I attended a webinar earlier this week through the Bar Association about how to conduct public hearings remotely, which is important because we will have a planning board meeting at the end of April at this point, and they are gearing up through our new planner Jaime Martinez to do that via Zoom and make sure that all of the documents are available to be viewed at that point, and how those meetings can and should be conducted. It's, as we say, the new normal at this point, so we just keep moving on with that. Earlier this week, I sent to Jamie and Bill Garrison an email. It wasn't too short, was it, Jamie? About the special events policies throughout the state. That will form the basis of what will be our next discussion and a draft local law. I do want to get to Jamie and Bill's input because there's a number of different areas to look at. But what I'm pleased to say is that a number of the questions that board members raised during our work session are really answered by a number of other jurisdictions. Insurance questions, questions of what is the purpose of this, how do you define what a special event is? All of those are basically dealt with in many of our sister jurisdictions throughout the state. And I look forward to providing that to you. I'm also going to be working with Bill to put together a draft for the youth board in terms of the composition, so that when we can get that before you folks, once the county approves it, we can get the legislation and hit the ground running. So that's where we are at this point. I do also want to just thank my paralegal, Lisa Ferguson, who has been working from home, but has been checking in even before I get into the office, ladies and gentlemen. And she has been providing a good deal of research on a number of the issues that are hitting us right now. And one of them she's looking at deals with payment for water bills, which we'll discuss a little later, because we do have a resolution tonight, if I can just get to it, which we discussed last week, which is essentially to put a moratorium on penalties for the water bills for the next couple of months. And I want to thank Dale Ferrara for bringing it to our attention and being able, and thank the board for putting it there. We are also working going forward with the agreement with Mass Electric Construction Company for the property down near the prison. That's the village property down on Westerly Road. An agreement is being put together and has in fact been forwarded to Mass Electric, and I'm waiting to get their comments back. So with that, thank you very much.
Stuart, I have a couple of questions.
Sure.
One of them is related to the construction is no longer happening across the board. There are many projects that would not be allowed to begin. So you mentioned that our planning board is going to be beginning they're going to be holding their meeting at the end of April. We'd put everybody, all the land use, all the boards and committees on a 30-day, take a break, but they'll be back to work to hear some of the proposals. So do we have a plan for, I wouldn't want the clock to start ticking on someone's permit if they can't actually begin constructing. So is there a way to accommodate for that?
Well, first, Mayor, there is. Right now, I believe the executive order dealing with construction expires, I think it's the 15th or 16th of April. So we'd have to see if the governor renews it, but it's a fair point. And more also in terms of projects that are currently pending, because you're supposed to complete your work within a certain period of time. Your permit only lasts. I think clearly, administratively, all those permits would have to be extended. I mean, I don't think there would be an issue there. One of the things that I have talked with Land Use Council about, and we'll also be talking to the planner about, is there are a few provisions in our zoning code where if the boards don't act within a certain period of time, it's considered an affirmative approval, sort of an approval by default. What we're going to be doing is, in those circumstances, requesting from the applicant an extension of time. The one that's most, that's currently pressing, and we do have an extension of time from the applicant, deals with the request for a zoning change involving the Secor Road properties. Technically, there's supposed to be a recommendation from planning within 62 days of referral. I've spoken with Mr. Silva's attorney, and he essentially said take whatever time is needed. But I do think that with regard to if the restriction on construction is continuing, I do think that there would need to be some administrative method of essentially extending those permits out. I'll discuss that with Karen, with Joe, and with Heine, so that that can all be done, so that no one is basically hurt by the fact that we have those time requirements. Particularly, as we know, with zoning variances, it's 6 months from when the variance is granted, unless work has started. But in many of these cases, they can't start work. So I think in all those cases, it may be that we may have to effectively stop the clock.
Right. Okay. Then my other question is, I bring it up, it's a town-county issue, but I've already been asked today because we've started getting our bills in the mail for our tax bill that is due at the end of April if you own property anywhere in the town of Ossining or the, I guess, county of Westchester. And there was a question of, will there be forgiveness of late fees? And my understanding is, last I heard, that that's up in the air. Do you know legally who is the entity that would grant the allowance of forgiveness of late fees or not?
My understanding, Governor, I'll answer it this way, Mayor. What I was advised by Holly Perlowitz, because she gave me this answer, is that under the real property tax law, the taxing municipality can request from the state a deferment of the payment. That request, though, if granted, is only for 21 days. Alternatively, the governor can, by executive order, make a direction to provide a longer period of time. Thus far, there's been nothing in any of the executive orders with regard to real property taxes. I do not know if any of the communities within Westchester have in fact made a formal request to the state for a deferment. Basically, it's in the case of where there is what's considered a local emergency, which I think this would certainly qualify as. Particularly, we have a declaration of emergency, the town does, but that's a state decision. It cannot be done, at the local level. And if it's a local request made, the deferment is only for 21 days.
Okay, thank you very much. That's helpful.
Stuart, and Mayor, there was a conversation on the county call today amongst the town supervisors talking about the county would like to work with towns on an opt-in basis. So there may be some changes coming down there too for local taxes. So
That's great.
Okay, I'm glad to know that it's being discussed, and I'm sure that nobody is all that eager to pay their April 30th tax bill if there might be a possibility of deferring it without penalty. So I'm sure folks will just wait a week or two and see how this unfolds.
Right.
All right. Are there any other questions for Stuart before we ask the chief? Yeah, Manny.
Thank you. Thank you, Victoria. Thank you, Stuart. Early today, and we had our first Zoom meeting for the landlord-tenant portion of what is going on in there, and something that was talked about briefly. Stuart, probably you definitely know better than I do, and definitely will be able to express that better in regards to one of the laws that came down from Albany about rent. and what happens that landlords cannot evict tenants due to non-payment at this point of time for the next 3 months at least. Could you
That is correct.
could you
What the
a little bit more, please?
what the executive order provides is that, well, first, two things. One, all the courts are closed, so you can't bring an eviction proceeding. The court in White Plains does have basically very limited operations, which they're all going to be doing now remotely. They sent out an order on that today. Evictions are not considered an essential matter. So basically, all evictions are off for 90 days. If there was a judgment of eviction already signed, that is stayed for 90 days. So at least for the next 90 days from when that executive order was issued, and that was, I believe that may have been last week, early last week, for 90 days, there can be no eviction proceedings. The court obviously will not sign any orders of eviction at this point because there's no judges to do that. The local courts, our town our town justice court is closed until the 30th of April at the earliest, certainly for all civil matters, which would include eviction proceedings. So there's nothing going forward on that. I should point out, though, there is nothing in the executive order that abates rent. So to the extent that a tenant owes rent, that rent would still have to be paid. But what it simply means is that if a tenant is in arrears at this point, the landlord cannot commence an eviction proceeding for the next 90 days.
Thank you, Stuart.
Sure.
And just to be clear, and I know you said it, Stuart, the courts, it's for civil that they're closed. All criminal acts and arraignments are still being done. I don't want people thinking we're in the Wild West all of a sudden.
No, but the point to be known is that everything is now being done through White Plains. It is what they've set up there is essentially a number of judges who will be rotating through. It is all remote, and even for arraignments, that's correct. But what they've done is similar to the governor's order with regard to essential businesses. They're only dealing with essential court business. So
Right.
family court, it might deal with orders of protection or youthful offender or adolescent offender status. Or with criminal, it would deal with arraignments. On civil matters, all civil matters are off. Unless there was a case that's still being tried, those matters are all off. And even on criminal matters, unless it involves, if it's a trial, unless it was going, it's off. But the arraignments, you're right, continue, everything being done remotely through the courthouse in White Plains.
Thank you.
All right. Can we, we're good with Stuart. Stuart, you've been working hard all day. You work early in the morning until late at night, and we still have more questions for you. So thank you so much for fielding all of our questions and providing us with so much insight tonight, but then also in our inboxes pretty much every day, all of the 13 executive orders you referenced. Thank you very much for keeping us informed and helping us understand how each of those executive orders translates to what's happening here on the ground in the village. Appreciate it.
You're welcome. Thank you.
Chief Sylvester, what can you tell us? What's going on with on the law enforcement front?
So ordinarily, ordinarily I like to come to these meetings and tell you about all the exciting things the police department has going on. Unfortunately, we are reduced to essential functions where most people are assigned to home now because of being non-essential. We have to come out of our houses, and our officers are continuing to patrol and do all of that. But we are reducing our operations really to only things that are most important. So we're sticking to public safety. All of our fun and games is sort of left behind for now. Most of my day and the command staff here is taken up with planning, replanning, contingency planning, contingency for contingencies, and we have contingencies for the contingency for the contingency. We have conference calls with all the chiefs in Westchester County on a daily basis where we're planning for everything up to including where departments go so far below staffing that we would have to have other departments come in two patrol force, which we are far from considering at this point, but to keep people at ease that the law enforcement function will never, ever, ever go down. We've got all of the contingency plans in place. Right now, our department is doing really well in terms of staffing. Our officers have sufficient PPE to get us through for at least another week, and we're constantly on the hunt for more. But right now, we've got some gear to keep us safe. We are continuing to go on calls, and thankfully, we haven't had any infections within the department yet. So right now, we're asking people to stay indoors when you can. Obviously, as Lindsay said, it's good to be able to go outside. Our numbers are about where she said they are. The numbers she gave was for the village. There's a handful more outside in the town. But again, I think that the most important thing we heard from Lindsay tonight was that the numbers that are coming in for Ossining are much more a reflection of the active testing going on at the open door than necessarily our community being distinct from anybody else. So we're grateful for all this information that we're getting and for all the work the open door is doing, because it's allowing us to know where our risk is so that we can take appropriate precautions and keep our staff safe, so that we can keep our staffing numbers up and continue to provide protection to the village. So right now, I know that there's a lot of rules out there about social distancing. We're asking everybody to stay indoors, to not congregate. Our officers are on patrol. We've stopped and spoke to a couple of businesses that weren't clear on what the executive order meant for them, and helping them to understand who's allowed to be open and who's not. But, we're getting a lot of internet messages, sometimes in the middle of the night or sometimes early in the morning, from residents who are concerned about things they're observing. One thing that I really want to encourage people to do, if you have a situation that's concerning to you, please call our desk at 914-941-4099. Our desk officers are there 24 hours a day, 7 days a week, 365. Our Facebook admins are not. But again, we're just asking people to be patient with us as we're trying to figure this situation out just the same as everybody else.
Thanks, Chief. Does anybody have any questions for Chief Sylvester? All right.
Before you continue, Mayor.
Yes, sir.
We were listing the long list of heroes, and on that list, I want to name our uniformed folks. How's my internet? I feel like internet is breaking up. It's COVID attacking my internet. No good. No good.
Your face isn't moving, but we hear you.
Yeah, it's freezing you here and there, but we still get the idea.
Well,
okay, great. So thank you, Chief Sylvester. Thank you to the police, because it's not, you're putting yourselves out there. You're on the front lines, and I'm grateful, and we are all grateful. So thank you.
Yeah, thank you for the reassuring report that the contingencies are all in place, and we are nowhere near exhausting our contingencies. That is very reassuring, that public safety is still able to operate as we need you to. So thank you so much for that. All right. We have, now it would be time for any organizational announcements. Is that right? Martha, normally I would throw it to you, but considering this weird plan, I'll just try and follow along here, and you jump in and tell me if I'm doing something wrong or skipping something. Okay, Martha? All right. So it's time for organizational announcements. I am looking to see if there are any attendees who are raising their hand. We have a few folks here who are attendees. They are not raising their hand right now. I'll give them another moment to just look on the bottom of their screen and notice that raise hand is one of the options. Okay, not seeing that. But as always, if there is an organizational activity event that's coming up, obviously there's not any events or gatherings that are happening right now, but people do still have some information that they're sharing, or virtual happenings in our community. Jamie, who is on with us this evening, as always, puts together a weekly web blast. So get that to her by noon on Wednesday, and you can be included in that email that goes out on Thursday. And people really do respond to that and pay attention to that. It's a great way to communicate with folks. Rika, you unmuted yourself. Did you want to add an organizational announcement?
No, I accidentally unmuted myself when I went to look at participants.
I just didn't want to move on if you had anything you wanted to say.
Thank you.
Then we'll move on to, this is an opportunity if anybody wants to comment on the board resolutions. We have a number of them this evening. I'm looking again. I do not see any hands raised among our attendees. So I will take that as a sign that we can invite the clerk to get us started with item A on our resolutions.
Okay. Approval of minutes, March 16th, 2020. Resolved that the Board of Trustees of the Village of Austining hereby approves the minutes of the March 16th, 2020 special meeting as presented. Do I have a motion?
So moved.
So moved.
Comments on the board? Madam Clerk?
All those in favor?
Aye.
Aye.
All opposed?
I abstain.
Who's abstaining?
That
Bob
would be
Fritchie.
Trustee Fritchie.
Bob? Okay. Approval of voucher detail, April 1st, 2020. Resolved that the Board of Trustees of the Village of Austining hereby approves the voucher detail report dated April 1st, 2020 in the amount of $230,700.62. Do I have a motion?
So
So
moved.
moved. Second.
Second.
Comments on the board? Madam Clerk?
All those in favor?
Aye.
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 Opposed? Opposed? Okay. Adoption of revised special sick leave provisions concerning COVID-19. Whereas on March 16, 2020, the Board of Trustees adopted the special sick leave provisions concerning COVID-19, and whereas subsequent to March 16th, President Trump signed into law the Families First Coronavirus Response Act, and whereas subsequent to March 16th, Governor Cuomo signed the law S-8091, an act providing requirements for sick leave and the provision of certain employee benefits when such employee is subject to a mandatory or precautionary order of quarantine or isolation due to COVID-19, and whereas the recently enacted federal and state laws provide benefits to employees which differ in some respects from the available employee benefits detailed in the March 16th special sick leave provisions, and whereas the village wants to institute a policy that is consistent with the recently enacted legislation, now therefore be it resolved that the Board of Trustees adopts the revised special sick leave provisions concerning COVID-19 be printed below, effective immediately, and it is further resolved that the adopted revised policy shall be provided to all affected village employees and shall be prominently posted at the Municipal Building, 16 Croydon Avenue, John Paul Rodriguez Austining Operations Center, 101 Route 9A, Joseph J. Caputo Community Center, 95 Broadway, and the Indian Brook Water Treatment Facility. Do I have a motion?
So moved.
Second.
Okay, so before we cast any vote on this, I want to welcome formally Steve Sage for joining us here this evening, and invite Steve or Karen. Do you want to comment on any of this? Karen, do you just want to, I know you've given a shout out to Steve and his tremendous work on being on top of so many constantly changing issues regarding personnel. This is a little bit of an update to what we very recently discussed and put in place.
Exactly. So I will hand it over to Steve at this point to go through the detail of the policy changes we'd like to see. So with that, Steve.
Thank you, Karen. I appreciate it. Just to walk through the situation, we adopted special provisions for our sick policy a couple of weeks ago, and we did that before the federal government or even New York State passed laws that sort of gave similar benefits to the ones that Austining had already provided. In light of the Families First Act, there were some additional reasons why somebody would be able to take paid leave without charges to their accruals, which were not in our original provisions. And so we just added those. We've combined quarantine and mandatory quarantine into one section and essentially use the federal government's law as the guiding principle for that paid time off. And then we've added provisions for some of the situations which the federal government calls for a prorated portion of somebody's salary, 2/3. For those situations, we will obviously honor the federal law, and then we're going to allow employees to cap up the rest of that time so that they can become whole for that time in which they need to take 2/3 time to care for a family member for various needs under the Families First Act.
Thank you. Does anybody have any questions or comments for Steve or Karen on this?
I do.
Please, Rika.
So could you tell me I'm sorry, I've been on meetings all day with my own work, and this is actually similar, but ours is a little different than this. So just tell me the progression order. I need to take time so I could use, there's sick leave, then I go to vacation, and then I go to personal. Is that how it's working?
Well, it matters. If you are there a situation that's covered by the federal government for paid time off, you are not charging any accruals. The federal law and the New York state law are very clear that we cannot charge somebody their accruals. This is in addition to their accruals. Should they exhaust the time that is provided by the federal government and or the state government and need more time, they would have the ability to then use their sick, then their personal, then their vacation for those times.
So they don't use that time. Do they accrue time while on leave towards their sick days and vacations going forward?
I'm sorry, I must not understand the question. You're saying
Okay.
that they count towards their accruals, the amount of time that they have that would go towards their accruals?
If you're sick, you're using the time that you have accrued, correct?
No,
Okay, go ahead.
that is not what the federal government says, and that's not what New York State says. New York State says that we have to provide paid time off for up to 2 weeks. The federal government says up to 80 hours, but the Department of Labor has specified that they interpret that as 2 weeks.
Okay.
That is not charged to your accruals. They have also provided for certain entities to recoup that money through taxes. Unfortunately, it does not apply to government entities, so we will not be able to do that.
I think that was more my question, so thank you for going back. I don't think I asked it correctly, so thanks for clarifying.
Yes, ma'am.
Thank you.
Anybody else?
All right. Thank you very much, Steve. If there's no other questions, then we have a vote on the table, motion on the table. All those in favor?
Aye.
Aye.
Oh, sorry.
I think, was that ayes all around?
Yeah.
Okay.
I have to abstain. I was
Okay.
not present at that meeting.
Well, actually, this is a brand new item. It's up to you. I mean, you're always welcome to abstain, and you don't have to explain why.
Oh, no.
But this is
I
just
just
an
saw the
update of the policy. In fact,
Okay,
it
March
was brought to us just the other day. So.
Okay,
It was
so
just
then I'm in
sent
favor.
earlier today, Bob. It wasn't discussed before.
Okay, I saw the March 16th date. That was my bad. So I'm in favor.
Okay. You got that, Martha? That was
Yes,
unanimous
so
then.
everybody's in favor? Okay, got it.
Yes.
Yeah.
Okay. Okay, moving on.
Moving on
Um,
to item D, right?
Yes.
Okay.
So a resolution authorizing tax share payments for 172 Highland LLC, 172 North Highland Avenue. Whereas certain tax share proceedings were instituted against the Board of Assessors and/or the Assessor of the Town of Austin and the Board of Assessment Reviewer 172 Highland LLC against petitioner's property situated at 172 North Highland Avenue in the Village of Austin and designated as Section 89.15, Block 1, Lot 13 for the 2015, 2016, 2017, and 2018 assessment years. Under index number 65232/2015, 63735/2016, 64566/2017, and 64913/2018. And whereas the Village of Austin ceased being a tax assessing unit in 1989 and now adopts the Town of Austin assessment roll for the Village of Austin as prepared by the Assessor of the Town of Austin for all subsequent years. And whereas on February 24, 2020, a consent judgment was entered in favor of the petitioner 172 Highland LLC against the Village of Austin in correcting, fixing, and reducing the assessed valuations of the aforesaid real property and the improvements situated thereon, as set forth in Schedule A, Annex Tier 2. And whereas the aforesaid consent judgment, among other things, directs that there shall be audited, allowed, and paid to the petitioner by the Village of Austin and the Town of Austin the amount of village taxes paid by the petitioner, taxes against the said erroneous assessments in excess of what the taxes would have been if the said assessments made in the aforesaid years had been determined by this order, together with interest on the date of payment thereof as provided by statute. And whereas the aforesaid consent judgment also provided that all tax refunds are to be paid with interest pursuant to Section 726 of the Real Property Tax Law of the State of New York, except that in the event the refund of taxes is paid within 60 days from the date of service of a copy of this judgment with notice of entry, this interest is waived together with the amount of interest and penalties, if any, paid on the excess of any aforesaid taxes by reason of delinquent payment. And whereas a consent judgment with notice of entry was served upon the Treasurer of the Village of Austin by petitioner on March 6, 2020, now therefore be it resolved that the Board of Trustees of the Village of Austin, upon certification by the Village Treasurer that all of the aforesaid taxes have been paid, hereby authorizes and directs the Village Treasurer to make the payment of such refund of real property taxes to 172 Highland LLC, to Herman Cagney Welks and Klein LLP, as attorneys and agents for 172 Highland LLC as required by said consent judgment, and be it further resolved that the village treasurer is authorized to make the aforesaid payment so the village may avoid the payment of any penalties, and be it further resolved that the village treasurer shall make a notation in the margin of the assessment rolls in the village of Austining that said assessments were reduced and payment of a refund of the overpayment of real property taxes was set pursuant to said judgment. Do I have a motion?
So moved.
Can we get a second?
Second,
I think
yes.
May-
Yeah, if I take my mute off, second.
Second, okay.
Comments on the board? Madam Clerk?
All those in favor?
Aye.
Aye.
Opposed? Okay. Authorization for the village manager to issue a request for qualifications for claims management and adjustment services. Resolved that upon review of the Corporation Council, the village manager is authorized to issue requests for qualifications for eligible third-party administrators to conduct claims management and adjustment services for the village's automobile and general liability claims. Do I have a motion?
So moved.
Second.
Second.
Comments on the board? Madam Clerk?
All those in favor?
Aye.
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 All those opposed? Authorizing the village manager to sign a license agreement with Mass Electric Construction Company for the issue of village-owned property. Resolved that upon review by the Corporation Council, the village manager is authorized to sign a license agreement with Mass Electric Construction Company, 6 Gramerton Avenue, number 60604, Mount Vernon, New York, 10550, for the use of village-owned property on Westerly Road for the tax map designation of Section 97.06, Block 1, Lot 21. Do I have a motion?
So moved.
Second.
Comments on the board?
So
Madam
I
Clerk.
actually don't
Yeah.
see the, sorry.
We
I don't
hear you.
see, yeah, I'm sorry. I'm trying to find while I'm on here. I'm flipping through to find the actually write-ups of what is, do we have a copy of what the final agreement looks like, or are we just authorizing the village manager to complete the transaction?
This is
Because
just
we
an
had some
author- this-
discussion about what the parameters should be.
That's correct. This is just an authorization at this time
To do what?
to execute an agreement with them. We've forwarded an initial agreement to them, and we're waiting to get their comments back.
Okay, so we on the board don't actually know what the agreement looks like at this point. We just had conversation though about it with a pretty
That's
good
correct.
understanding.
Right.
We
They're not
discussed
the-
some of the basic,
The basics we have in terms of, I think, where we are in terms of what the lease agreement will be and what the lease term will be. And the question I have, Mass Electric is looking to start, I hope they were thinking sometime this month. I should point out that the work that they are doing is considered essential business because it relates to the railroad. So they would be able to proceed with the work that they have to do. So that's, and I'm waiting to see if they, what suggestions or changes they have to the agreement that has been forwarded to them earlier this week.
Okay. All righty.
okay. Madam Clerk?
All those in favor?
Aye.
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 Opposed? Okay. Deferral of payment of penalties of unpaid water bills to June 5th, 2020. Whereas Village of Austining Code Section 259-49, penalties for late payment, states in part, the following scale of penalties is hereby prescribed for the neglect to pay water charges levied under Section 259-49 after the levy thereof. A. No penalty shall be charged if paid within 25 days after the charge has been made. B. If paid at any time after the expiration of 25 days after the charge is made, 5% of the charge and an additional penalty of 1% shall be imposed for each period of 30 days thereafter, or part thereof that said water charge remains unpaid. And whereas, as a result of the new coronavirus pandemic, which is causing significant disruption, the Board of Trustees and village staff are looking for measures to relieve some of the financial and emotional stress. Now therefore be it resolved that penalties on every water's account balance from March 6, 2020 shall be deferred until June 5, 2020, and be it further resolved that the village's finance department shall take all necessary actions to implement this resolution. Do I have a motion?
So moved.
So move.
Second.
Yeah, my only comment on this would be, to really thank Dale Ferrara, I believe is the one who brought to our attention that this was coming up. There are so many people who are financially in a very difficult position right now, and that unfortunately is going to continue for some time. There aren't too many opportunities where the village can step in and try and alleviate a little bit of that financial burden, and this is one opportunity when we can, and I'm pleased that this was brought to us and that the board is supportive of making this effort that we can, where people are a little late on paying their water bill, but we're not going to penalize them for it. And so thank you very much for bringing this to us. I'm pleased to be able to support it. Does anyone else have any comments?
I do. I'm in total agreement. I think this is, I'm in support of it. I think this is the right thing to do. I think we should look for every opportunity because, as I stated earlier, this is an economic strain, an emotional strain. That being said, one of the responsibilities, our oversight responsibilities, is to always find out what affects our decisions, also have on budgets. So in a for-profit business, moving monies 2, 3, 4 months out would actually affect cash flow, and it affects a whole bunch of things. In municipalities, not so clear to me exactly what effect any of this have, but as we make the decisions, and I'm sure we'll be making more of these correct decisions, I would like to have somebody look at the financial impact this will have probably for next year when we look at budgets and we approve this year's, but any financial influence that any of our decisions have needs to be highlighted under COVID-19 issues, whether it's an overtime for someone, whether it's sick leave for somebody else, or whether it's deferment of payments or penalties, et cetera, et cetera. Again, for the right decision, I'm just interested to see what the effect might be.
Karen, I think it would be helpful for us to keep in mind when we have a little bit of a clearer picture that we'll want to invite either Dale or Tom to come and talk to us, because I assume we're going to be drawing on our fund balance, which is very healthy, and that's what it's there for. It's not exactly a rainy day fund, but we do have a healthy fund balance, which is what has kept us from having to raise taxes in recent years. But as we draw down on that to be able to address needs like this and to compensate for the shortfalls in anticipated revenue, it would be helpful to have a picture of what that looks like, whether that's in a May meeting or when that makes sense. I'll leave it at that.
Absolutely. So this is something that we've already spoken to Dale and Tom about. So we anticipate, if not the next work session, we would be having a meeting pretty soon on this to sort of discuss the implications even more immediately where we are, and then looking forward. Right now, to your point, this is not a significant cash flow issue for this particular initiative. So, and we have a very healthy, we have a healthy water fund balance. So, but as we are thinking ahead to what the implications of the virus are in terms of not only planning for next year, but what the implications are for this year's budget too. So we will be putting that together. We're already working on that. Yes.
Great. Thank you so much.
Thank you.
Oh, we have a motion on the table. Do we still need to vote on something? Okay. Madam Clerk.
All those in favor? All those in favor?
Aye. Aye.
All opposed? Okay. Authorizing settlement of Emmanuel Giannios versus Village of Austining et al. Resolved that upon recommendation to the Corporation Council and the Village's Outside Defense Council, the Board of Trustees approves the settlement of the case Emmanuel Giannios versus Village of Austining et al. Commenced in Supreme Court, Westchester County under index number 53905-2019 for $650,000, and it is further resolved that upon review by the Corporation Council, the general release and stipulation of discontinuances with prejudice, the village treasurer is authorized to issue a check in the amount of $650,000 payable to Emmanuel Giannios and Marvin A. Cooper, PC, as attorney in full satisfaction of the settlement of this action. Do I have a motion?
So moved.
Second.
Comments on the board? Madam Clerk?
All those in favor?
Aye.
Aye.
All opposed? Fire Department Independent Host Company number 6, removal from active roles. Resolved that the Board of Trustees of the Village of Ossining hereby removes Scott Cotillo and Frank Valenzo from the active roles of the Ossining Fire Department, Independent Host Company number 6. Do I have a motion?
So moved.
So moved.
Second.
Comments on the board? Madam Clerk?
All those in favor?
Aye.
Aye.
Moving on to continuing business of the board, discussion of cabaret license application for La Isla del Tesoro.
I believe this is the topic that we discussed last week, and then it came to light that there was maybe some information that we didn't have ready to discuss at the time, and that we now want to revisit the decision with more information.
May I go?
Please.
Okay. So when this came up at the last board meeting that I had attended, I had misspoke. I didn't realize we were going to be discussing, or that I'd be attending that session, and I misspoke. Thought it was a different establishment. 185 Main Street, and the business that's there has been a sustained business for a number of years, and this business continues to apply for cabaret licenses year after year with no improvement. Looking back over the years, we have hundreds of police reports from this place. The most of them are premise checks where we spend a good portion of our night with the sector car, spending time and just hanging out outside to dissuade people from being outside, making noise. We have a number of complaints from neighbors, but most notably, this business was cited on January 4th of this year for a village ordinance violation for operating without a cabaret license. So in spite of the fact that they've been denied a cabaret license on a number of occasions, they're operating without one, and that doesn't seem to stop them. We've written a number of state liquor authority violations over the years, and it appears that they've not lost their license, but notwithstanding, this appears to be a place that doesn't make a lot of effort to improve the type of business they're doing. The majority of calls that were calls for service there are fights, disturbances, otherwise noise and disorderly conduct. So it would be my recommendation that they not be granted a cabaret license.
Chief,
Please, Manny.
can I ask you a quick question? So in regards to operating without a cabaret license, what is the ticket, or what is the penalty on something like that?
So we don't issue fines. We issue summonses that bring them to court, and then it's argued by the corporation counsel or his deputy, and the judge ordinarily would be the one to issue a fine. So it's a violation, so I don't believe it's all that significant in terms of dollar value. But the reality of the situation is that in making a decision on who we're going to issue permits to, cabaret licenses are generally seen as something that would bring live music, DJs, things like that, that would draw a larger crowd. This particular place has been, would, in my opinion, be more problematic with a larger crowd. And that's my concern for the cabaret. I don't think that there's the ability to have a whopping fine for a village ordinance violation that would really dissuade people from doing it. I think that when you're trying to run a business, the mere denial of the license in the year going forward is usually significant for people to sort of cooperate with us. And I will tell you that over the years, I've had almost every bar owner come to my office, sometimes in groups, to talk about how they can do things better and how they can work with us to improve. And this particular owner has been here, and we've had this discussion. So it's not for a lack of trying that that we haven't been able to work with this particular establishment. They just don't seem to be able to fall into compliance.
So, I'm sorry, Rika, Chief, if we deny the cabaret license, what happens next again?
Nothing. Their business continues. This isn't the license to operate as a bar or a restaurant. It simply denies them the ability to have live music or a DJ.
And if they do, what happens? If they do anyway, what happens?
They'd be summoned again, and they'd be brought to court again.
Okay.
So where do we stand, Stuart, from a legal perspective? Because we did consider this last week. Now we are reconsidering it with more information.
Right. The board did approve a resolution granting the license. what would need to be done is that there would have to be a resolution based upon new information provided to the board at this meeting, that upon consideration, the board has determined to deny the cabaret license application. So I can, have that resolution for the board. Village Clerk Donnelly has not issued the license to La Isla del Tesoro based upon the fact there was going to be a discussion tonight. I will advise her to continue with that, and then I will have a resolution for this board so that this would be done. I should point out that I have been in contact with the owner of the venue. I gave him the contact information for tonight's meeting and invited him to participate if he so chose. When he at that point indicated that he may well do that, but does not appear that he has. But what the board would have, what we would do is just another resolution, effectively revoking the license based upon presentation of new information.
Okay. So, as far as tonight, what would you like to see from us? What can we do here? Does anybody, I feel like what the chief has told us is pretty compelling and obviously sets us up for a different consideration than before we had this information. Is that the sense of the board?
Yeah, I agree with
That's
you.
where I am. I'm definitely in favor of declining because of this information.
Right. Yes.
I agree.
Okay,
I'll prepare the resolution.
thank you.
Thank you.
Obviously, there's no cabarets happening right now, so it gives us a little bit of flexibility in working it out on this occasion.
At least we hope not.
Well, that's a bigger set of concerns then.
Yeah.
The governor will help us with that issue, unfortunately. Okay, so that's it for continuing business then. All right. Is there any new business that I'm unaware of? Okay. Let me just see if there's anybody. Oh, hold on. It is time for visitor recognition, and there's a visitor with their hand raised. So we're going to get to try this out. Jamie, is this me? All right.
I let Marcos 1985 into the meeting.
Welcome, Marcos.
Yes, hello. My name is Segundo Quintuna, and I'm representing La Isla del Tesoro. And I just wanted to make a comment about the cabaret license. We just want the license to be able to have a DJ at least, so we can, because we're not the only bar in Austin that has DJs. But we just want to, be able to have a license to be able to have the DJ and not do it, without one. We just want to do the things right, the right way.
Okay. So you've been on the meeting, so you heard the concerns that were brought to us by the chief of police.
Yes, I have.
Do you refute any of the concerns that were raised about past experience that you've had, that we've seen?
That's been a long time, though. It's we just want to be able to, like I said, to have a live DJ, because we're not the only bar in Austin that has live DJs.
Well, it's perfectly fine to have a live DJ if you have been granted a cabaret license. And as was stated, a cabaret license, we love people getting cabaret licenses. It means that there's more activities going on in our community, more places for people to go, more people out enjoying nightlife in Ossining, and that's generally a good thing. When it's not a good thing is when the police end up getting involved because there's some concerning behavior, whether that's fighting or just any other violations that we want to discourage. So I think I'm just sort of reiterating the sentiments of what we're discussing. So I appreciate you coming on tonight and expressing your interest. It's not often that the police department discourages the board from supporting a cabaret license, because we are predisposed to wanting to encourage businesses to be able to have activities like you're describing. It's not something that we take lightly to turn one down. Yes, Chief, would you like to?
If the owners of that establishment want to meet with us and talk about ways that we can help them to improve their business, we're always willing to do that. So if that's something they're interested in, they can call my office, and we'll certainly set up a time to sit down with them and talk about ways that we can help them improve.
Okay, thank you. That would be great.
All right, thank you very much. We look forward to hearing any further discussions, anything that might come out of those discussions.
All right, thank you so much.
All right. Okay, so I didn't realize who that person was. There's nobody else with their hand up for the public comment portion, the visitor recognition portion of the meeting. So with that, I would request a motion, unless there's something I'm forgetting. I'm looking at Karen and Stuart. Is there anything else? Otherwise, we'll do a motion to adjourn to executive session for matters related to personnel, related to specific persons. And is there something else?
Real property, please, Mayor.
You got it. Is there a motion for those two items?
So moved.
Second.
All in favor?
Aye.
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 Thank you, everyone, for joining in this virtual Village Board legislative session. I think it went relatively smoothly. I'm grateful for the participation of Steve Sage and Lindsay Farrell this evening, and we wish the best for everyone in the community. Remember how important social distancing is. It's not easy, but it is incredibly important. Remember that today is Census Day 2020. If you have not responded to the census, now is your chance. You got a census ID number in the mail. That makes it easy, but you don't need to have your census ID number. If you go to the census website and just say, I don't have my number, there's still a way for you to be able to respond to the census. And everyone who responds is helping Ossining to be accurately represented in our government and to be able to access the funding that we need for all of the services that we provide to our community, for us to be able to serve the community well. So with that, I will say thank you very much to everyone. We will see you in the very similar format next week for our work session. This meeting is adjourned to exec.